Hello there again. All right, part 1B. Let's go. Specific glands and their hormones. Please follow along. Pituitary gland sits right through here in the base of your brain like a little punching bag. Hangs from the stalk from the hypothalamus, protected by the sphenoid bone. That's the crazy Star Wars-like spaceship that sits right in the middle of your face. And there's two functional lobes, anterior and posterior. Posterior is actually neural tissue, anterior is glandular tissue. Let's look at how they work. There's 6 anterior pituitary hormones. Yes, know all of them. Yes, know what they do. 2 affect non-endocrine targets, meaning other things that are not glands. And then 4 of them are tropic hormones that stimulate other endocrine glands to release a hormone. So when one hormone triggers this gland to release another hormone, the original hormone there is called a tropic hormone. All of the anterior pituitary hormones are amino acid based or polar. They all act through second messenger systems, of course, as a result, and they work through negative feedback to maintain their levels. So let's look at these. First of all, we have growth hormone, GH, which stimulates growth, both length and girth of muscles and bones. We have PRL or prolactin, which stimulates mammary glands. FSH or follicle stimulating hormone, which works on testes and ovaries, depending on which one you have. And there's also luteinizing hormone or LH, which works on testes and ovaries, again, depending on which one you have. We'll spend far more time on those when we do our pregnancy unit. We don't go too in depth in those in this unit. TSH, thyrotropic hormone, or thyroid stimulating hormone. A lot of people call it thyroid stimulating hormone, not thyrotropic hormone, but it triggers the thyroid to release hormones. TSH is a tropic hormone, as you can tell. And then we have ACTH, adrenocorticotropic hormone. It's also a tropic hormone. In fact, it affects the adrenal cortex. That's the whitish region out here, and we'll talk about how the adrenal cortex works. So there is 1, 2, 3, 4, 5, 6 hormones, all from the anterior pituitary. Now, growth hormone, it's a major metabolic hormone. We already talked about skeletal muscle and long bone growth. Causes protein production, also causes breakdown of fats to release energy, which is why it's so beneficial if elite athletes are injecting growth hormone. It's undetectable because they already produce it, and it causes protein production and energy from fats. So it's very commonly abused, it is thought, in professional athletic bodies. Prolactin. It stimulates milk production after childbirth. We don't know what it does in males. Yes, males can produce milk, but don't ask me to. That's prolactin, and we don't really know what its function is in males, but it stimulates milk production. Not milk release, milk production, producing it. ACTH stimulates adrenal cortex, as we said, and TSH, thyroid stimulating hormone, influences thyroid gland secretion or activity. And then we have FSH, follicle stimulating hormone. Just to touch on it briefly, and we won't go any more in depth than this. In females, it stimulates follicle development in the ovaries. So to give you an idea, a follicle is the structure that incorporates the egg that will be then ovulated for fertilization. So a follicle has to develop and grow to protect the egg. That's what FSH does, follicle stimulating hormone. That's in females. And then in men, it actually triggers sperm production, sperm development in the testicles. LH triggers ovulation, luteinizing hormone. So every month when a woman is going to ovulate, she gets what's called an LH surge, a very large or high peak of luteinizing hormone. And that's going to cause the follicle that's housing the little egg to pop open and to release the egg that's inside. And the corpus luteum portion, don't worry about that right now. And then in males, it stimulates testosterone production in the testes. In the males, sometimes it's often referred to as interstitial cell stimulating hormone, or ICSH, but we, for the most part, just call it LH. It just happens to work in both sexes. So how do the pituitary and hypothalamus work? So first of all, the hypothalamus will release a hormone that affects the anterior pituitary. The hypothalamus the release of hormones is controlled by releasing and inhibiting hormones produced by the hypothalamus. So the hypothalamus can secrete a hormone that will block the pituitary from releasing anything or activate it. The hypothalamus is going to produce two hormones that are transported to the posterior pituitary through neurosecretory cells, meaning it's a neuronal path. It's not through the bloodstream. The posterior pituitary does release hormones, specifically oxytocin, which stimulates contractions of the uterus during labor, the lovely pain of labor. And then it also causes milk ejection. So you remember we talked about prolactin triggering milk production. Well, now here we have milk ejection. So the suckling of the baby on the nipple will trigger a release of oxytocin to very, very high levels. In fact, through positive feedback, more and more triggering its own release over and over. And that causes milk ejection. And then the second hormone from the posterior pituitary is antidiuretic hormone, ADH. A diuretic is something that makes you pee. So antidiuretic hormone is what you will secrete from the posterior pituitary if you don't want to pee very much. You want to maintain your water levels or hold on to water. And as a result, it can cause increased blood pressure. So part of your blood pressure is manipulated through the levels of ADH and how it affects the kidney. The ADH directly works on the kidney to keep more water or to pee more water out. So in this case, high levels of ADH will make you hold on to more water, and thus your blood pressure will also increase. So here you see the posterior pituitary directly connected by this stalk that you see there, and it affects the posterior pituitary to release ADH and oxytocin. And that's it for this one. On to part 2.